What if I told you that the constant late-night trips to the bathroom, the weak stream, and that restless feeling of never fully emptying your bladder might not be just part of getting older, but something you could start improving in just 7 days? It sounds bold, I know, but stay with me. You've likely heard the statistics. By age 60, about a third of men will deal with the symptoms of an enlarged prostate. By age 85, that number skyrockets to 90%. It feels almost inevitable, a frustrating, sleep-depriving part of aging. But the secret isn't just about shrinking the prostate itself. The secret lies in a coordinated 7-day plan that gives your entire urinary system the relief it's been begging for. And before we dive in, let's clear one thing up once and for all, because it's the fear that keeps millions of men awake at night. An enlarged prostate, medically called benign prostatic hyperplasia, or BPH, is not prostate cancer. It's a benign, non-cancerous condition. It does not increase your risk of cancer. So let's release that fear, take a deep breath. You're not broken. And in the next few minutes, you'll see exactly how to take back control, starting with one simple week.
Before we dive into the 7-day plan, we need to understand exactly what we're up against. Picture your prostate like a donut. Right through the middle runs the urethra, the tube that carries urine from your bladder out of your body. Now, as you age, your body's hormones shift, particularly one called DHT, a powerful offshoot of testosterone. This hormone makes that donut swell, slowly squeezing the hole in the center tighter and tighter. This blockage is what causes all the problems. Your bladder has to push harder, your stream weakens, and that constant urge to go, even when you just went, becomes a daily frustration. But here's something most men, and even some doctors, don't talk about enough. Your bladder isn't just a passive storage bag. It's a powerful muscle called the detrusor muscle. And when it's forced to fight against that narrowing opening, day in and day out, for months or even years, it starts to weaken and fatigue, just like any other muscle would. That muscular fatigue is why you often feel like you can't empty completely. Your bladder simply doesn't have the strength anymore. Now, standard medical treatments are often effective. Medications like tamsulosin relax the muscles to open the passage. Others, like finasteride, block that DHT hormone to actually shrink the prostate. And if those don't work, there are excellent minimally invasive procedures and surgeries. But they can come with side effects that many men don't love, like dizziness, or even sexual side effects like a reduced libido. So what if there was a way to complement medical care, or in some cases, delay it with a natural reset that helps your whole system?
That's where this 7-day secret fix comes in. This is not a detox. It's a system reset. One that focuses on 3 powerful pillars: dietary flushing, liquid management, and bladder training. For just 7 days, you're going to give your urinary system a break from the things that irritate it and feed it with the things that calm, strengthen, and restore it. If you're still watching, that's a good sign. It means you're serious about this. So let's get into Pillar 1, because this one alone can create a noticeable improvement in less than a week. This part is simple but incredibly powerful. We'll focus on 2 things: what we take out and what we put in. First, what to remove for just 7 days. 3 things. Number 1, caffeine. Your morning coffee, black tea, that soda, it has to go. Caffeine is a diuretic, meaning it makes you produce more urine faster, but more importantly, it directly irritates the bladder lining, keeping it twitchy, sensitive, and overactive. Number 2, alcohol. Your nightly beer or that glass of wine, alcohol has the same double whammy effect. It's a diuretic and a bladder irritant. Plus, it messes with your sleep cycles, making those 3 a.m. bathroom trips even harder to avoid. Number 3, artificial sweeteners. This one surprises most people. Aspartame, sucralose, the stuff in diet sodas and sugar-free snacks. They're known chemical irritants that can trigger that feeling of urgency and frequency almost instantly. So for 7 days, cut them cold turkey. You can do anything for a week. The payoff? Within just a few days, most men notice a calmer bladder.
Now, for the fun part, what we're going to add. First, replace your morning coffee with a high-quality green tea. Yes, it has a little caffeine, but far less. And it's loaded with powerful antioxidants called catechins that have been shown to help reduce inflammation in prostate tissue. It's a significant upgrade. Next, every single day, you must eat 2 things. 1, a handful of pumpkin seeds. This is non-negotiable. Here's why, and it's fascinating. Your prostate gland contains one of the highest concentrations of zinc in your entire body. It needs zinc to function. And studies have shown men with BPH often have lower zinc levels. Pumpkin seeds are one of the richest natural sources of zinc on the planet. They are nature's tiny prostate protectors. 2, at least 1 serving of a red fruit, like tomatoes or watermelon. These are packed with an antioxidant called lycopene, famous for its prostate protective properties. And here's a cool trick. Cooking tomatoes, like in a sauce or paste, actually makes the lycopene more absorbable for your body. Simple swaps, big impact. If this already feels doable, hit that like button. Not for me, but as a small promise to yourself that you're going to actually do this. Now, let's move on to Pillar 2, because this one directly tackles what most men complain about, those sleepless, bathroom-interrupted nights. Many men with BPH accidentally make their symptoms worse. They either drink almost nothing, which leads to concentrated, irritating urine, or they chug water, overloading the system. So here's your new rule for the next 7 days. Front-load your fluids. Drink the majority of your liquids before 7 p.m. Sip water or green tea steadily from morning until early evening. Then, after 7 p.m., you stop. Only small sips if you're thirsty or need to take medication. No more full glasses of water. This one change gives your body hours to process fluids and empty your bladder before you go to bed. It can drastically reduce nighttime urination. And here's a fascinating little fact. Temperature matters. When you feel cold, your body tightens blood vessels to conserve heat. This slightly raises blood pressure, signaling your kidneys to filter more urine. So staying comfortably warm in the evening can genuinely help calm your bladder. It's these small biological details that make all the difference. And we're not done yet.
Remember, your bladder is a muscle, and it can be trained. There are 2 techniques I want you to use daily for the next week. Technique number 1, double voiding. This is crucial for feeling empty. When you go to the bathroom, don't rush. After you finish, stay there for another 30 to 60 seconds, relax, and then try to go again. You'll be surprised, often more urine comes out. That's the leftover fluid your tired bladder couldn't release the first time. Doing this consistently helps you empty more completely. Technique number 2, Kegel exercises. Yes, men need them too. They strengthen the pelvic floor muscles that support your bladder and control urination. To find them, imagine stopping your urine mid-flow. That squeeze you feel? That's your pelvic floor. To perform a Kegel, just squeeze those muscles for 3 to 5 seconds, then relax for 3 to 5 seconds. Aim for 10 repetitions 2 or 3 times a day. You can do them anywhere. No one will know. And one last thing, sitting. Prolonged sitting puts constant pressure on your prostate and pelvic floor. For this week, make a conscious effort. Every hour, take a 2-minute standing or walking break. It gives your bladder and prostate a chance to literally decompress. All right, let's turn all of that into a simple daily checklist. Morning. Swap your coffee for green tea. Do your first set of 10 Kegels. Start sipping water steadily. Afternoon. Eat your handful of pumpkin seeds and your red fruit. Walk or stretch for 2 minutes every hour. Do your second set of Kegels. Evening. Finish your last big drink before 7 p.m. Practice double voiding every time you use the bathroom. Do your final set of Kegels. Stay comfortably warm. And for the entire week, remember the big 3 to avoid: no caffeine, no alcohol, and no artificial sweeteners. Stick to that for 7 days. Pay attention to how you feel. You might start noticing a stronger stream, fewer nighttime trips to the bathroom, and most importantly, better sleep and more energy. That's the power of synergy.
Now, let's be very clear. This 7-day plan is not a cure for BPH. It's a plan to manage and dramatically improve your symptoms. It is absolutely essential that you speak with your doctor for a proper diagnosis and to discuss all your options. And if you ever experience serious symptoms, like being completely unable to urinate or seeing blood in your urine, that's an emergency. Contact your doctor right away. For most men, this plan is the difference between feeling helpless and feeling in control. So, are you in? If you're going to try this 7-day challenge, let us know in the comments below. Tell me which part you're starting with first. Your experience might be the exact motivation another man needs to take back control of his health. And if you found this helpful, hit subscribe and turn on notifications, because you won't want to miss what's coming next. In our next video, we'll talk about the most scientifically proven supplements for long-term prostate health. Until then, take care of yourself, stay consistent, and remember, your body has an incredible ability to heal when you finally start working with it.